With us today is plastic surgeon Dr. Mark Mitchell-Jones. Dr. Jones is board certified as an otolaryngologist, also known as an ear, nose, and throat specialist. He is a current member of the prestigious American Society of Plastic and Reconstructive Surgeons and the American Society of Aesthetic Plastic Surgery. Dr. Jones has an established practice located in Atlanta, Georgia. Doctor, welcome to the show.
Thank you, Pat. It's good to be here.
Now, we've just learned that 90% of aging is a result of overexposure to the sun and the elements. And I can imagine having your practice in Georgia, you might see a lot of sun-damaged skin. What can we do to combat aging before it's supposed to happen?
Well, Pat, there are a lot of patients in Atlanta who do have problems with sun-exposed skin. There are multiple ways that we as plastic surgeons that have evolved into giving them help. One of the ones that I like that's very new, that's been without many side effects and very good results, is microdermabrasion. I find this, in the big scheme of things, for many patients is probably the preferred method of helping them with their little fine wrinkles and their texture of the skin, or improving the quality of the skin.
So then what is the extent of what can be accomplished through a full facelift?
Well, with a full facelift, we can actually change the shape of the skin, the muscle, and the fat. We can lift. Hence the French lifting procedure, or facelifting. We lift the procedure to take you back to the way you were when you were younger. We can't get back to the way you were when you were 20 years old, but we can certainly take the clock back to a better time, a better age, maybe 7 to 10 years.
Now, one procedure that's really growing in popularity is called blepharoplasty. What is that, and what can you accomplish with it?
Blepharoplasty is an operation that I think is the best buy in money for plastic surgery today, because people look at your eyes first. And if you start to age, usually because blinking all your life, the skin, the muscle, and the fat sag. So you'll have a little sag right at the lower eyelid, or you'll have extra skin up above. I think that that is a very good maneuver to treat this and to improve the appearance.
Charlotte Woodman has had a full facelift performed and is here to share her experience with us. It's nice to have you here, Charlotte.
Thank you, Pat.
So what were your reasons for wanting a full facelift?
I had the problem primarily with saggy eyes, and puffy eyes is what I would refer them to, and someone had brought to my attention while we were in the midst of discussion that, oh, you have saggy eyelids. Well, that just made me cringe, made me upset, and made me realize just what was happening in my life at the time of aging, the process. So I went through research and saw what I could do, or inquired what I could do, and talked to some people who had it done, and the results of what they had done, how it looked on them. And that brought me to the decision to go have it done to myself, plus the fact that my son was getting married, and I wanted to look my best, of course, for his pictures and for him.
Could you show us exactly what you did for Charlotte?
Yes, Pat. On Charlotte, we pulled her forehead a little higher, not too much, just enough. And that allowed also me to do a little bit better eyelid procedure on the upper lid and the lower lid to take out the excess skin, muscle, and fat. On her cheek, that gets pulled up a little bit so you don't have the little drools, the sides that hang. And then in the neck, where we're starting to see the little muscle bands and the neck muscle relax, the folds, we could pull that tight so that she has a much better neckline as well.
In your opinion, why would you say that it seems that people are getting these facial procedures done at younger ages than even was the norm 10 years ago?
Several reasons, Pat. One is we found that generally people are better off, as from a physiological or a science point of view. We can do a better job if we do it early than late. It's like a car engine. If you have an engine that you keep up and keep it in tip-top shape, it will last longer. But if you let one part degenerate, it's going to affect the other parts, so you get 4 parts degenerating in the car engine. Well, the same with the face and the skin. We cannot yet rejuvenate good skin, so that if we can keep it in good shape and pull it and keep it firm, it will last a lot longer.
Well, Charlotte, thank you for joining us today.
Thank you for having me.